Unfortunately, SARS was not without casualties. One by one, people fell to SARS. The number of casualties increased slowly from 1, 2, all the way to 33 on 23rd of April 2003.
The killer bug is now striking the front line of defence. Doctors, nurses and healthcare workers now make up a quarter of all victims. And SARS is becoming more aggressive. The number of victims expected to triple within weeks. Despite government assurances it's under control, doctors are no longer willing to hide their grave fears.
These are Miss Rose, Miss Vasanti and Professor Leo from Tan Tock Seng Hospital. Miss Rose and Miss Vasanti are healthcare workers who had contracted SARS in 2003, while Professor Leo is the head of the Department of Infectious Diseases at Tan Tock Seng Hospital.
Because how I get it was like, because I was in the ICU and I was just helping out because I was down in Empower, right? So I was helping my staff just with the patient. I was having like persistent fever, very high fever. I was having some chronic disease, heart disease. So I was just helping her to admit the patient to the bed, and then just to get her to get much more comfortable in our ICU. And that is when, after a few days later, I was down with this fever.
Symptoms was spine pain. That was the very first symptom. As I was after my work, actually I went home. I was just sitting on the sofa watching a movie. Then suddenly there was a sharp pain on my spine. Then that pain really is intolerable that I got to just drop on the sofa. I can't sit straight. So from there, after a few hours, I shoot fever. And fever shoot up. The highest is about 41. So it was very, very high. That was my.
So as how is it?
Okay, so for the first one, ensure safety, right? So what we did was that before we sent our healthcare workers to take care of SARS patient, we trained them to put on a face mask, also trained them to put on the personal protective equipment, so in short we call it PPE. The mannequins still there, right? Yeah, so you can have a look. So you can have a look and a glove, right? It may look simple and easy, but proper use and know how to use them is in fact very important. So all of them went through this exercise, how to put on a mask, how to make sure that the mask fit them nicely, how to put on a glove, how to put on a PPE. Alright? So then that was our initial reactions. We want to give the maximum protection to our staff, right? Two will be the environment. We have to make sure that the patient is properly isolated in the proper isolation facilities so that there's no cross-contamination. Patient don't move, we move, because if you move the patients, these infectious patients may potentially go around and infect other people. So these are the things that we put in place. Now, scientifically today, if you challenge me to say that what is the mode of transmission? So in other words, how does this virus transmit from one person to another person? So then we say, okay, this is likely to be a droplet transmission. This is likely to be a contact transmission. Droplet transmissions means that you need a much bigger size particle in transmission, and usually bigger size particle they cannot fly very far. So we always use 1 meter, 3 feet as a rough indicator how far a droplet nuclei will fly. Airborne, of course, then it can be very far. So if that is the case, a lot of people challenge me that, so do you think you have overdone it? You have provided safety measures more than what is being needed? Answer is probably yes, but we really do not know the answer. Because we didn't say one group of healthcare workers, surgical masks, one group of healthcare workers, N95. Okay? So then the next question is that, should SARS return? And it's droplet transmissions, you know the exact property. Would you still let your healthcare workers go through N95? My answer would be it's very likely yes, because it is a disease of such high mortality. If I can protect anyone from getting it, I will do my best in doing that.
So could you give us a kind of a rundown of how an average day in your life during the period was?
So my day is morning all the way till late at night in the hospital. If I did go home, it will be very late at night. Just go home and sleep. The next day, start the routine again. So I never really get to see sunlight, for quite some time.
Okay, so did your experience with SARS affect how you perceive your work or your colleagues at Unsung?
I think SARS changed the life of many people. I think so. I think many of the people who went through SARS, I think the bonding is very, very strong. And I think SARS also changed the way we look at infectious disease. But it's very sad to hear from my colleagues, how badly they're being treated in some situations. Some of them, they refuse to. One of the bus stop just in between the Jalan Tan Tock Seng, coming up to Tan Tock Seng, and also the Mandalay Road, the skin center. There's one bus stop there. Some of the buses refuse to stop in the bus stop. So it just highlights this fear that expressed in the behavior in the public. It's not right or wrong, but it's just fear. Fear is a common feeling, right? Fear is a very protective common feeling of human.
Fortunately, things took a turn for the better. The media started to shed light on the healthcare workers' efforts, overturning the public opinion overnight. Support poured in many ways. A fundraising effort, the Courage Fund, was set up on 11th April 2003 to provide relief for SARS victims and healthcare workers. The public donated generously as a show of their support to the healthcare workers, a stark contrast to how they were previously. In fact, they donated about 15.5 million Singapore dollars to the fund. The government pledged beforehand to match the donations, $1 for $1. So the total sum of donation ended up reaching around 31 million Singapore dollars. People also started writing in messages of gratitude and encouragement to the healthcare workers. In fact, these messages were arranged and made into a wall of encouragement that can be seen today in Tan Tock Seng Hospital. Organizations and hotels also started sending in food donations and health supplements to the healthcare workers. The government also took many key measures. Among the things it did, the government traced the spread of SARS to find the possible sources by issuing a home quarantine order to individuals suspected of having come into contact with a SARS patient. These individuals were not allowed to leave their homes, as they may infect other people. Each of these individuals were given an RFID chip, which they had to wear at all times. The RFID chip ensured that the individuals stayed at home by alerting the police if they left their houses. This measure effectively stemmed the spread of SARS. The saga witnessed the unifying of citizens against a common cause, the government's efforts in combating an unknown disease, and, of course, the professionalism and the spirit of self-sacrifice from the frontline healthcare workers. Everyone played a role in fighting SARS.
And so, on the 31st of May, 2003, the World Health Organization declared Singapore to be SARS-free.